Hey, what's going on, guys? Welcome to another video on my channel, Hairliciously. If you guys are new to the channel, please make sure to hit that subscribe button so that you guys are updated on hair loss and hair transplant topics. Visit my website at hairliciously.com to purchase your microneedling devices, which are scientifically proven to stimulate hair growth, my low-level laser picap, hair growth vitamins, DHA blocking shampoo and serum, and a few other products for those who are suffering from hair loss. So in today's topic, I wanted to dive into microneedling as a recommended hair loss treatment regimen. There's been a lot of good scientific evidence and data that confirm the efficacy of microneedling in promoting hair growth. The exact mechanism of action works by stimulating the growth factors and also activating the stem cells that lead to hair growth from the wound healing process. There was one particular study by Dr. Durat that was conducted between the two groups. It's a pretty famous study. One group was using 5% Minoxidil twice a day. The other group was using a combination therapy of Minoxidil and microneedling weekly. And the results between the two were pretty staggering. Around their 3-month mark, the group that was using Minoxidil and microneedling saw about 4 times more hair count, revealing that the group treated with microneedling and Minoxidil was statistically higher to the Minoxidil only treated group. Definitely a big difference in terms of hair growth from one group to the other in these photos here. So it is a highly recommended protocol that people who are suffering from androgenic alopecia should definitely incorporate. There are, no associated side effects, unlike hair loss medications such as finasteride or dutasteride. The only thing you might see is some pinpoint bleeding or erythema on the area that was treated. And as long as you guys are using sterile needles, making sure that they're sanitized properly, you don't have to worry about anything as far as infections. So I've been microneedling my scalp after I found out about it after my first hair transplant, and I have been using it pretty consistently on a weekly basis in conjunction to Minoxidil. This is the one that I use for Minoxidil, Costco brand Kirkland. There are people that use it without Minoxidil, but studies do show that you get far better results when you combine the two. And from the study, it's not like we're using Minoxidil right after microneedling. They're applying it 24 hours after wounding, so that also reduces the possibility of any potential side effects from Minoxidil. There are people who claim that it works better when you apply Minoxidil right after microneedling, and most likely due to the absorption into the scalp. But I like to stick with the 24 hours as the study indicates, and because of that, I have not experienced any side effects. The device that I use is the Dr. Pen, as you guys can see here. It comes with different needle cartridges ranging from the 12 pin to the 36. I stick with the 12 pin because I find that the 36 tends to latch to the scalp and it tends to pull out the hair. If you're applying it on straight up bald areas, the 36 would be the way to go. But if you have hair like myself, or if you guys are miniaturizing in just certain areas, such as the temples or the vertex, I would definitely use a 12 pin. It comes with 2 batteries, so you can actually use it wireless, not get it all tangled up while you're microneedling. It has 5 settings. I like using the highest setting because it tends to be the less painful. And this blue dial ranges from 0 to 2.5 millimeters. There are people that use it all the way up to 2.5 millimeters on a daily basis, which is just insane, causes a lot of pain and bleeding. And I would imagine it to be more harmful than it would be beneficial to the scalp because you're not allowing the healing to take place. But anyway, this device, the nice thing about this is that you can also use it on fine wrinkles, blemishes, scars, and things like that. I recommend using the Dr. Pen over the manual roller because a roller tends to cause more trauma just based on the physics of how it rolls against the scalp at a 45-degree angle. It causes additional tearing on the scalp, whereas a microneedling device, such as this one here, is done perpendicular to the scalp. So the needles only go in and out perpendicularly, and it doesn't basically drag across the scalp like it does with a roller. It's also done via a mortar, so the pressure tends to be more consistent, whereas if you're using it manually with a hand for a derm roller, it's not going to be consistent. So I'm going to give you guys a quick demonstration. It works better, obviously when you have shorter hair, it's a lot easier to maneuver, but you can always part the hairs on the areas that's being treated. I like to focus, especially on the temples here, way up here where all of the miniaturization and also the hairline is focused. And when I say temples, I don't mean like the new temples that were, built from the hair transplant. I'm talking about the prior temples before my hair transplant, which would be like way up here. I also like doing the temporal points just because these temporal points were always my weak point. I had receding temple points, and I don't know if you guys can see, but there's been a lot of thinning going on the sides, I guess in terms of retrograde alopecia. So I'm gonna get started. I'm gonna be opening up a brand new needle cartridge here. It's all sealed up. I like replacing mine after each use because, I'm just using it once every week. So the 12 pin, you want to stick it in your needle cartridge into the Dr. Pen, and then you want to set it up to 1.5. So I don't know if you guys can see. It's set up at 1.5. Press this button here, you hold it. You can hear the buzz and the green light, and you can actually press it 4 more times to go to the 5th setting. So there it is. And what I'm going to do is I'm going to show you guys how I actually utilize this on my scalp. So I like starting from the temporal points here. And then just kind of going in circular motions. Some people like using numbing cream, but you know, this is something that's bearable, and I feel like you don't really need it. You just kind of have to bear through it and just pull through. It's only going to be for a few minutes, and what you want to do is you just want to kind of focus on one area for a few seconds. Now in my case, all of the hairs here have been transplanted, so I don't really focus too much on that. I just focus on the areas where the native hairs are located, which would be on the sides here. So it does sting a little bit. I don't know if you guys can see, but my eyes are kind of watering, but it's nothing that you guys are not going to be able to bear. And it's pretty simple. You just work your way across the scalp, and you can kind of see some of the redness that's happening. Some people do start bleeding a little bit, and that's totally normal. It just depends on how thick your scalp is. And as far as pressure, just applying moderate pressure. I'm not like jabbing it into my scalp or anything like that. And just work your way up. You know, part the hair so that you can get access to the scalp. Right up in there. And it actually kind of feels good too. Part the areas. So if you guys didn't know, I did get a hair transplant, and my original hairline used to actually be maybe like up there. I've actually lowered it about, I want to say maybe 1.5 centimeters. So you really want to focus on the areas that are prone to miniaturization and just work your way through. Now, like I said, it's a lot easier if you have shorter hair, just because you don't have to worry about all the long hair that kind of gets in the way. But even if it does, it's not a big deal. And I can definitely feel the pricking that's happening against the scalp. So it's pretty simple. It's not rocket science. I think some people try to make it a big deal out of all the different types of protocols and exactly how to utilize the microneedling device. But it works really well. It's built really nicely. And I've had this for almost 2.5 years. And the only thing that I would have to just change out is the needle cartridges. And in the long term, it seems to be cheaper than a dermal roller, just because you have to kind of replace it after, every, I don't know, maybe 2 to 3 or even 4 uses, because the needles would get dull. But in this case, I don't have to worry about that. Just go ahead and pop in a new needle cartridge, and then just work my way in. Pretty simple. Typically, each treatment takes me anywhere from 10 to 15 minutes. Just depending on, the areas that I'm focusing on. But particularly the temporal points, I think I've been able to kind of stabilize the hair loss there. I used to start thinning a lot more. And so, pretty happy for that. I just wish that I was able to kind of thicken it up a little bit more. But because of the whole retrograde alopecia, I just like to kind of cut the sides really short. But I've been pretty consistent with microneedling and using minoxidil on the sides, and even also on the temples. And basically just, work your way into the hairline. And that's pretty much it, guys. Like I said, the Minoxidil that I use is from Costco, Kirkland brand, 5%. And it's been working well for me. I know some people like using the foam version just because they might be allergic to some of the ingredients in the liquid version. But that's how it works, guys. If you guys have any questions on how to use a microneedling device for dermal roller, let me know in the comments below. If you guys are interested in getting your own, I actually have some on the website, hairliciously.com. You guys can check it out and take a look. But that's all I have for you guys in today's video, guys. Thanks for watching, and I will talk to you guys next time. Take care.